What we're going to go through before we even assess any muscles is some of the important considerations required to use real-time ultrasound in clinical practice. There's 4 important things. The first is your client and where you are and where the machine is, so your positioning. The next we'll look at the machine in more detail and the transducers. The next one will look more closely at the panel and the key features that we should be looking at, including depth, focus and frequency. And the last thing we'll look at how you can improve your image. Okay, let's start with the first one. So the first one is the client must be able to see the machine. You're assessing them, they need to be able to look at what you're seeing, and that will be how you're retraining them. Where you are sitting is important, or you may be standing, but when you start using the machine, it's very important where you are so you're not hurting yourself, so you've not got too much twist on you. You need to be able to work the dials, see the machine and the client as well. Okay, the second thing, the machine itself. So firstly, let's look at, you'll tend to have 2 transducers. The first one we call a curved array transducer, and its frequency tends to be lower, anywhere between 2.5 and 5 megahertz. And when you're using this, you want to also look for, so that the client can see where you are, where is the dots, so the client can see where that dot is. And if we come on the screen here, you'll see the dot up the top here, so it's showing you which direction that they can relate to when you're assessing them. Now you have another transducer. The second transducer we call a linear head. Okay, with the linear head you have a higher frequency, anything from 5 up to 10 megahertz. And that's the important thing to remember. With a higher frequency, you'll be looking at more superficial structures. With a lower frequency, you can look a lot deeper. Now, if you're going to switch from one transducer to the other, you will need to change that on your machine. So if you have a look, you'll find on your machine it indicates probe. And here you can see, if you come to the screen again, I've got the linear transducer here. We go on the screen, sorry, the curved transducer, so we'll go back there, the curved. And if I change that, I'm now on the linear. So be aware of which transducer you've chosen and what you're going to look at.